Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.
Maladie sida kontinue ap fè ravaj. Li deja touye 40,4 milyon moun nan le moun antye. Men, ak progrè la syans, maladi sa an ba kod jodi ya. Dapre Organizasyon Mondial la Santé, en décembre 2022, te gen 39 milyon moun ki tap viv ak sida. Le maladi a te fèk komanse, se te yon sentans pou lan mor. Jodi ya, sida se yon maladi kronik, tankou diabet ak tansyon, paske gen remèd pou kontrole sida. Medikaman pou sida diminue kantite virus ak nivou aktivite virus a genyen nan komoun. Si test HIV ou pozitif, sa pa vle di ou gen sida, men sa vle di ou nan route pou al devlope maladi sida. Si ou pren remèd ou régulièrement, virus la vin indétectable et puis il vin intransmissible. En anglais, on dit undetectable equal untransmissible. Ça veut dire you equal you. En créole, il fait indétectable égale intransmissible. So nous-mêmes, nous dit 1 égale 1. Remèd yo ap diminue risque ou genyen pou développer maladi sida. Yo pap ka détecter gem nan sang. Ça vle di ou pas ka passer gem nan ba l'autre monde. Haïtien, mes frères, yon de l'autre, on nous bloque sida.
And Commissioner Robbie Goldstein, welcome. Welcome again. You know, you came into your position about a year ago?
Almost exactly 1 year ago. Yes.
Exactly 1 year ago. And prior to that, you were doing work with the CDC. Can you tell us how your work with the CDC has informed the work that you're doing now with the state of Massachusetts?
Yeah, so for folks who don't know this, I spent 2 years at CDC before I came to state government. I came in to CDC in February of 2021. So if you just sort of imagine what was happening then, we were at a very different stage of the COVID-19 pandemic. I think the country was in a different place back then in 2021. And I had the great fortune of working closely with the CDC director at the time, Rochelle Walensky, who was a boss of mine previously, a mentor of mine, a good friend of mine. Rochelle taught me a tremendous amount in my time working with her at CDC and before. But I think one of the things that I take with me in my work at the state and in the Department of Public Health is that 10 weeks after she joined CDC, she declared racism a serious public health threat. And she did it not because it wasn't known. We all knew that racism was a threat, but she did it because her words could drive action. And when she made that declaration, she challenged 14,000 people across the Centers for Disease Control and Prevention to commit themselves to addressing racism in public health and healthcare, and to break down the barriers that exist for far too many. And over the 2 years that I worked with her at CDC, we did a lot of great work to advance health equity, to address systemic racism, to think about the structural barriers. When I came to DPH a year ago, it was really important for me to do the same here in Massachusetts. To not just say the words that racism is a serious public health threat in Massachusetts, but to then come up with an actionable plan of how do we address health inequities, disparities, the racism that exists in the system, and how do we move the entire Commonwealth forward, every resident, so that they're all having access to health and healthcare services, that public health is doing what it needs to do for all of our communities.
Awesome. And she spoke the words, right?
She spoke the words.
She spoke the words. So now you're speaking, in your role at DPH, you're speaking and you're moving, right?
Yes.
There's a lot of speech and action.
Yes.
The fact that you're here with us shows us that. Now, can you share some specific health disparities that you've identified since you've been in your role for the state of Massachusetts at DPH?
Yeah, so I don't want to take credit for everything. We have an
Sure.
amazing team at
Sure.
DPH that has been doing this work for many years. But when I came into the department, just a few months later, we put out our annual opioid overdose death report, which we've always disaggregated by race and ethnicity, by geography, to really understand the inequities that exist in the state. And we put that out, and not only did we report tragically the highest number of opioid-related overdose deaths in Massachusetts since we've been recording the numbers, but we reported that the rates are increasing dramatically for Black residents, for Hispanic or Latino residents, in particular for men who are Black and Hispanic, and for Indigenous residents. And those disparities drove action. We came up with a plan of how do we get our resources, our harm reduction services, our education, into the right communities, into the right languages, so that we're addressing that disparity.
Yeah.
And I would say, I thought, that happened 2 months into my job, 3 months into my job, and I thought we would spend the next year talking about that inequity, and just a month later, we put out an even more sobering report on severe maternal morbidity in Massachusetts that showed not only are there inequities, but there are terrible discrepancies between what resources white women have in this state when they're pregnant and going through their pregnancy and what Black women have in this state. To the point that severe maternal morbidity, rates of severe maternal morbidity are 2.5 times higher for Black women in Massachusetts than they are for white women in Massachusetts. And so we again said, we're not just going to say the words, we're not just going to report the data, we're going to come up with an actionable plan of how we actually address this issue and move us in the right direction.
Awesome. And when you talk about the plan and being in the community, can you share how DPH partners with the community to help address those disparities that you just talked about?
So we have a lot of community engagement embedded in our work at DPH. What we're trying to do is be more intentional about it. And I've seen that work over the past year. We have a community engagement unit that is really charged with holding these relationships, making sure people have a seat at the table, making sure that we're hearing the concerns that are coming from the community. We're thinking intentionally about how do we use our resources and translate into the right languages, get into the right media markets, make sure that we're sharing information in the appropriate channels so that everyone knows what we're doing, how we're doing it. And then we're trying to be very intentional about sitting at the table and listening instead of talking. Right? Because community engagement is not just about me showing up here in Randolph.
Right.
It is about me showing up in Randolph and closing my mouth and hearing what people have to say so that we can take that back and use state resources to address the concerns.
Listening. So right before we got started, there was a great comment that, addressed more resources for faith-based communities because that's where folks gather. When we think about the relationship between patients and their providers or even community members, trust is a big factor, and the people are going to the people that they trust. They're congregating there. Can you talk a little bit about the strategic initiatives to gather with folks who are already in a space where folks are already gathering, where there is trust? It's a great place to share resources, but might be overlooked at times. Can you address that a little bit?
So I had this really great experience just maybe it was about a month ago where out in Worcester County, where I think we're doing some of this work really well, which is that through our vaccine equity initiative, through our community engagement unit, two parts of DPH that are really thinking about how we engage communities, we've brought together a bunch of organizations that wouldn't think that they should all be under one roof. In that case, in Worcester, it's AIDS Project Worcester, which has resources for people with HIV and substance use disorder, with a food bank, with a physician who runs a clinic, with a lot of other community-based organizations. We brought them all together and we said, all of you are actually serving the same community. And sometimes they show up at your doorstep and they're asking a specific question, and sometimes they show up at the other doorstep. But why don't we bring you all together under one roof and think about how we can better serve this community? They show up to get some food from the food pantry, and at the same time, they can make sure that they have clean needles if they have substance use disorder, and they can also get their blood pressure checked because there's a clinic right there.
Amazing. Now, with all those interventions, are there any measures in place to kind of monitor the improvement over time of the work that's being done in the community? I know sometimes it's a little bit difficult, but is there anything that we could talk about today that can show some of those improvements over time? Because we want it to improve, of course.
So this is getting back to moving beyond words and getting into action, right? And so in my first year as commissioner, I've thought a lot about our strategic plan and our strategic initiatives, and not just what are those, but then how do we measure them?
Right.
And part of our strategy is to be more intentional about community engagement. So then how do we measure that we're going to be successful here? We're trying to put in specific checks on what we do to say, does the information that we put out, has it gone through a community process? Is it in the right language? Is it going to the right media? Are all of our funding opportunities first being evaluated and vetted by community-based organizations who are going to use the funding to make sure that we're writing these grants and these proposals appropriately? Right? We're putting in those checks and we're measuring how well we're doing. We have a goal that is 100% of our efforts are community engaged. That's a hard goal to hit, 100%. It means we have to be perfect.
Right.
We have to set the goal really high because it's so important to do it.
Shifting gears ever so slightly, cultural competency.
Yeah.
Very important. Can you talk about it in relation to the work that you guys do at DPH?
Yeah, it's really hard.
Yeah.
If you think about Massachusetts, there are 7 million residents, right? And everyone comes from a different community, comes from a different culture, has a different understanding of what their community and what their culture is. And we need to be fluent and competent in the language that everyone speaks. I'll give you one example of what we're trying to do here. And so for folks who remember from back in the summer of 2022, there was an outbreak of Mpox that happened across the country. It was a big concern for public health. We put out a lot of information at that time. We recognize that this is an ongoing concern in public health, and we're going to put out some more information. And we stopped ourselves as we were about to put it out because we realized it wasn't culturally competent. It was really focused on a small sliver of the population that probably already got the information 2 years ago. And what we needed to do was take the information back and think about, how do we translate this into the right languages? And when we translate it, does it maintain the same meaning? Will it actually impact the people that are going to read the document? And so I think, and you should hold us accountable to this, that we're going to put out information in the next few weeks that will get into the right communities and make sure that it is readable, it's understandable, and it's touching on the parts of people's lives that are most relevant to them.
I love how you talked about the translation portion of the health information. Is there any plans for DPH to think about supporting communities that do more audiovisual production to get that health education across their communities? Because there's a huge literacy issue as well embedded in our communities, and sometimes we often think that we can translate a document and it will be understood by some, but then I'm afraid we lose many that might not understand. So can you touch upon if there's the plan for that, or are you guys thinking about a different strategic method to communicating this health information to our communities?
I'll acknowledge that this is really hard.
Sure.
This is not what public health has done well for a long time. But I think we, just like every other industry, have to evolve and
Yeah.
adapt to how people learn and gather information at this moment. We are, I think, doing a really great job, led by our communications group at the department, thinking about how do we engage with social media, how do we utilize the right channels to get to people,
Yeah.
and then what we put out on those channels to make sure that it is put out at the right level, the right reading level, so that everyone can understand it, those who have literacy and can read, that it's in the right language, so that we're speaking to people in their native language and not forcing people to translate on their own. And I think every campaign that comes out, we get better at this, but we need feedback from the community. We need to
Absolutely.
know, that campaign you put out about flu shots this year just didn't really make sense to us. It wasn't at the right level, so that we can go back and do better the following year.
Yeah.
And that's part of, as I was talking about, the listening part of community
Yes.
engagement, that
Yes.
we have to be willing to listen and adapt.
Earlier in our conversation, you talked about having folks in the right room, folks from the community, right, be part of the conversation. Can you talk a little bit about folks from the community be part of policy change, conversations around policy, because it does drive what ends up happening in our communities? Does DPH engage the community when it comes to policy?
I'm going to answer that in two ways,
Sure.
because I think there are two ways that community can be engaged. The first is that we want to hear from folks, what are the policies that matter, or what are the issues that are most important, and what are the barriers, so that we can create the policy that will address the barriers and really focus on those issues. And I try, when I'm out and I'm talking to community, to listen to what people have to say, to recognize what's just not working,
Yeah.
and how can state government be better. We're being really thoughtful about that, I think, in a lot of our policy conversations. I'll throw out an example that this past fall, we put out a report on maternal health in the Commonwealth, and we did so only after a series of community discussions all across Massachusetts, where we listened to communities and we said, what is the biggest barrier to you accessing high quality, appropriate maternal health care in your neighborhood? And that informed our policy actions and informed our recommendations. So that's, I think, one way that we're doing this. The other, though, is that, and I think this is really important, is we're trying to engage with local public health and within the Department of Public Health to make sure that we're hiring people from the community. Because the best way to make policy is to be in the room
Right.
and make the policy with us.
Right.
And so we want to make sure that those that we hire into the Department of Public Health are representing the communities of Massachusetts, and that those people can bring their lived experience
Yeah.
to the policy discussions. That's actually, to me,
Yeah.
the best way that we can do this, because we will have, we have 3,200 people that work at the Department of Public Health. We want all 3,200 people to feel engaged in our policy discussions and to be able to bring their community experience into their work every single day.
Love it. Love both strategies. Very important. Now, if someone was interested in being part of those conversations, like you had mentioned with the maternal health, you guys went out and you listened. How does one find out when DPH is coming around, or do you host it? Is it a monthly thing, or how does someone get connected to know when will be another opportunity to have those listening sessions with the DPH?
Depends a little bit on what the listening session is for. For those maternal health discussions, we tried our best to leverage our relationships with community-based organizations, faith-based organizations, healthcare organizations to encourage people to join us. We went out into the community, we hosted some online, and we tried to use some of the technology to our benefit
Yeah.
so that everyone could feel that they could engage in the conversation. But we also have monthly roundtable discussions based on various topics. Our Bureau of Infectious Disease has an active advisory board around infectious disease issues and HIV. We have a Bureau of Family Health and Nutrition that has an active advisory board on maternal health and infant health. And we encourage people to be a part of those discussions, whether they have professional experience in maternal health or lived experience as someone who had a child, raised a child in the Commonwealth. Those are important voices to our advisory boards.
Love it. I'm going to switch gears. Insurance.
Yeah.
I know. Insurance coverage can be very challenging for minority communities. How is DPH working on making sure that everyone can, be insured in the state of Massachusetts?
So we're not in this alone. The
Yes,
Department
yes,
of
for
Public
sure.
Health works really closely with our colleagues at Mass Health and at the Mass Health Connector across the Executive Office of Health and Human Services to make sure that we're doing what we can to get people covered.
Yeah.
We have to recognize some success we've had in Massachusetts.
Absolutely.
97% of people in Massachusetts are covered by insurance, which is fantastic. Every child in the state really has access to health care and to health insurance. We also have to recognize there are gaps that exist. There are gaps of people who don't have insurance right now for many different reasons, and we need to find a solution for those individuals.
Yeah.
And then there are gaps for people who are insured, but we would call them underinsured. They don't have all of the coverage that they need. There's a role for the Department of Public Health to play, I think, in particular for those who are underinsured, just to make sure that the public health services are present for everyone, all 7 million people, and that those public health services can help fill the gap. These are things like making sure you have access to vaccines, even if maybe it's harder for you to get to the clinic in the fall to get your flu and your COVID shot. We can make sure that public health can get that for you. This is things like substance use disorder treatment and prevention, making sure that public health has a seat at that table. So whether you're fully insured, underinsured, or not insured, you still have access to prevention and treatment services. I think we also have a role in the 3% of people who aren't insured and trying to get them onto insurance.
Yeah.
And that is where our community organizations are so important, that if, at any given time, we have probably a dozen to 24 issues that we would love community organizations to help us with.
Got it.
But I would say at every moment, getting people insurance coverage and access to care, that's always on the list of things that we want our community organizations to help us with. So we see this as a partnership.
Love it. And now, we talked about various strategies, different topics. Representation in the healthcare workforce for the minority population, it is imperative that that increases. Is there any work that DPH is doing to ensure that to become something that we actually see?
Yeah. So I have so much I could say about this
Yes,
topic.
okay.
And I'll start by saying that the Department of Public Health oversees the Board of Registration in nursing, for physician assistants, for dentists, for community health workers, for you name it.
Yeah.
Anyone in the healthcare field, we have a role in the board that oversees who gets certified or who gets a license. That process, just like many processes in government, has structural biases in it, is a product of systemic racism, has been designed to support those who speak English at a high literacy level
Right.
and not those who speak another language. In the year that I've been at the department, we have begun a process, and I think we still have a lot of work to do, to look at each of those boards and to say, what are the barriers to people getting into these professions? How do we make it easier for the individual who is a certified nurse assistant who speaks Haitian Creole? How do we make it easier for that person to get certified and go work in a nursing facility where 95% of the patients speak Haitian Creole? And so we are putting the certification exam out in Haitian Creole. And we're putting it out in Spanish. We're putting it out in other languages so that we can get more people into the workforce and in many ways lower the barriers for them to get in. We're trying to do the same with nurses to make sure that people who have been trained as nurses in other countries, in other states, who speak a different language, who come from a different background or culture, that they have a pathway to get into nursing. And we have some levers that we can pull for physicians as well to encourage physicians from other countries to come into Massachusetts to work in communities where they may feel very at home and welcomed. And to make sure that they have a pathway to a license so that they can practice here and give back to their community.
And how would one be able to access that resource? I think with the influx of newcomers to this state, I mean, across the U.S., right? There are a lot of folks who have been well ingrained with the healthcare system back home, and then they come here and it feels like they have to start all over again. Is there a specific place that they should be going to or reaching out to access that resource?
Yeah, so I would say you could start at our website, where, and in particular at the Board of Health Professional Licensure, who oversees all of these various professions. And then depending on the profession, perhaps someone is a nurse assistant, perhaps someone's a nurse, perhaps someone's a social worker or a psychologist. There's a different board for each of those, and the boards can help walk through how do we make sure that we get you engaged? How do we answer your questions, get your application in? How do we bring you into the workforce as opposed to pushing you out of it?
Got it. Wonderful. So we talked about a lot today, and thank you so much for all of your responses. For my last question, can you discuss any, in addition to the ones that you already discussed, the successful initiatives and programs that DPH has implemented since you took on your role, and give me like 2 that you're most excited about?
So again, I don't want to take credit for all of this because I think
Absolutely.
people have been working on this a long time before I came in. But one initiative that I'm incredibly proud of is our Vaccine Equity Initiative, which I think many people in the community know about. If you don't know about it, you actually probably felt it. You probably got a shot from them because they came into the community and gave vaccines. But if we go back to your first question, when I was at CDC, one of my jobs at CDC was to look across the country and look at the data and understand what were the disparities in vaccine or vaccination across the country. So which states were doing a good job of getting Black and brown individuals vaccinated, which states weren't doing a good job, which states were getting their populations that weren't on insurance vaccinated versus those that were on insurance. And Massachusetts was always a leader in this. Massachusetts was always doing a much better job than the rest of the country, and that is because of the Vaccine Equity Initiative. And we've used the Vaccine Equity Initiative in the past year, not only to make sure that we continue to vaccinate people for flu and for COVID, but to think about as more people are arriving into the state and more children are arriving into the state, how do we make sure they're vaccinated for all those vaccines you get before you go to school? How do we get into some of the emergency shelters and the temporary shelters to do the vaccination efforts that are necessary? And I think the VEI, the Vaccine Equity Initiative, has done just a remarkable job in getting that work done in collaboration with community. So that's the first that I'll call out. I think the second that I'll call out is some of our work around maternal health, and in particular around making sure that we're listening to community, we're hearing what people need, and we have started an initiative to make it much easier for birth centers to open across Massachusetts. For people who don't know, birth centers are freestanding facilities where people can go deliver, usually with the support of doulas and midwives, as opposed to having all of the healthcare all around them, a huge hospital. And for many people, it's a more affirming and comforting space. We are working really fast at changing our regulations and supporting birth centers because we think that it is a viable way, a real important way of improving maternal health in Massachusetts and improving people's relationship with healthcare in Massachusetts, in particular for people who come from minority communities and marginalized communities. So those are the 2 that come to the top of my head of these initiatives are moving fast. They're having a huge impact, and I'm really proud of the work that they're doing.
Wonderful. Well, thank you so much, Commissioner Goldstein.
Thank you for having
your
me.
time.
Yeah,
Thank
thank
you.
you.
Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.
Maladie sida continue à faire ravage. Li déjà touye 40,4 millions de monde dans le monde entier. Mais, avec progrès la science, maladie ça en bas code jodi a. D'après l'Organisation mondiale de la santé, en décembre 2022, il y a 39 millions de monde qui t'a vive avec sida. Les maladies a été fait commencer, c'était une sentence pour la mort. Jodi a, sida c'est une maladie chronique, tant que diabète et tension, parce que il y a un remède pour contrôler sida. Médicaments pour sida diminuent quantité virus et niveau activité virus a gagné dans commune. Si test HIV ou positif, ça pas veut dire ou gen sida, mais ça veut dire ou en route pour développer maladie sida. Si vous prenez un remède régulièrement, le virus devient indétectable et puis il devient intransmissible. En anglais, on dit undetectable equal untransmissible. Ça veut dire you equal you. En créole, il fait indétectable égale intransmissible. So nous-mêmes, nous dit 1 égale 1. Remède a diminué le risque au gagné pour développer maladie sida. Yo pas ka détecter gène dans le sang. Ça veut dire ou pas ka passer gène dans l'autre monde. Haïtiens, mes frères, y'une de l'autre, on nous bloque sida.